Hi everyone. In this video I'll be doing a question and answer session related to some mental health topics, particularly focusing on depression and antidepressants. This is actually a response to questions that were submitted to me as part of a research project. So they are questions that someone is asking different professionals as they research these topics in the area of mental health treatment. The first question is, which methods do you believe are the most effective to reduce anxiety? And my response here is that for anxiety reduction, the methods that work best are usually ones which address the root causes of anxiety, such as addressing thinking patterns and beliefs, unresolved emotions from past stressful or traumatic experiences, and lifestyles that have overstressed a person. This means using cognitive therapies, mind-body therapies, stress reduction therapies, trauma healing therapies, and diet and lifestyle changes. Yoga, physical exercises, mindfulness, meditation, energy therapies like Reiki, acupuncture, and energy psychology, cognitive therapies, hypnotherapy, regression therapy, nutritional therapy, aromatherapy, herbs, and connecting with nature and taking a break from technology and man-made electromagnetic fields can all help reduce stress and anxiety. Which methods will work best can vary from one client to another. So that was the first question. The second question that we have here is, how do you determine whether a patient is in need of antidepressants? Well, I'm a mental health counselor, as well as a holistic therapist and spiritual energy healer, and not a physician who could prescribe medications, so I can't make that determination in the context of providing medical advice. My own experience, research, and personal perspective on the topic of needing antidepressant medications is that they are not truly needed at all, although they have been embraced by many people as a short-term symptom relief due to lack of awareness and inadequate efforts to implement other forms of support and assistance to help people address the causes of their symptoms. Antidepressant medications are chemicals that are not part of the natural balancing mechanism of the mind-body-spirit energetic system. They actually cause imbalance and disturbance and chemical dependency over the long term, as they lead the body to adapt to the presence of the drug by maintaining an abnormal pattern of the body's own neurotransmitter regulation. People already taking an antidepressant may seem to need it because of the withdrawal symptoms experienced if a person attempts to stop taking it. Those withdrawal symptoms show how the medication actually further impaired the body's natural self-regulation of biochemistry. From a holistic systems understanding, it becomes apparent that short-term symptom-suppressing psychoactive drugs will often foster long-term harm and worse outcomes because they are interfering with natural feedback mechanisms and leading to a bypass of opportunities to develop one's own consciousness and psychological coping skills and self-management skills. This is analogous in a way to using drugs that suppress the immune system when a person has a wound or infection. The symptoms of the body's immune activity, such as inflammation, fever, or pain, may be unpleasant, but that activity is part of the self-healing process, and interfering with it via symptom-suppressing drugs can often prolong or worsen the illness. The wiser choice in both cases is to support the natural healing processes with things that truly nourish and help rebalance the person. Coming now to the third question. Would you recommend medication in cases of mild to moderate depression? Well, I kind of already answered this in the previous question, so I'll say that again. As a counselor rather than doctor, I can't directly recommend prescription medication use, though I can let clients know that is something they could discuss with their physician. My own opinion is that medications would do more harm than good in the long term, and that the consciousness and energy system are what have the greatest influence on our body's chemical activity, aside from the acute effects of food, medicine, and supplements. Rather than using medicines, if one wishes to help support biochemical pathways, then food and nutrients are valuable therapeutic aids. For depression, there are B vitamins, vitamin D, omega-3 fatty acids, SAMe, magnesium, L-tryptophan, 5-HTP, and other natural supplements that are often helpful and don't present the high risk level of adverse effects or dependency associated with antidepressant drugs. For physicians to discuss prescription drugs and not discuss the many safer alternatives that don't require a prescription seems irresponsible and unethical to me. Coming now to the fourth question. How do you construct your therapy sessions to meet the patient's needs? I begin by building rapport and gathering information and personal history from the client. Then, as we identify factors contributing to the presenting concerns, I seek to apply therapeutic modalities and resources that will help address those factors, as well as empowering the client to apply things on their own as part of their routine that will help with the identified issues. This is an individualized process that can include conversation with the client, psychoeducation, specific therapies I provide, such as cognitive therapies, meditation, energy healing, family therapy, hypnosis, and so on, as well as recommendations for practices that they can use at home, and lifestyle changes such as shifting diet and sleep patterns, getting more exercise and time outdoors with exposure to sunlight and nature, rather than excessive interaction with fluorescent or LED lights and digital screens. We're coming now to the fifth question, which is how do you determine a patient's level of depression? Observing the clients in the sessions, noting their mood, their affect, their energy level, and verbalizations, collecting information about symptoms and past history, how the symptoms impact their daily functioning. Those are ways to determine from a diagnostic perspective how that patient is functioning and how their particular emotional state would be diagnosed. In my view, depression describes a state that people can experience at varying levels of intensity and for any length of time, and which they can shift out of at any time. It is not a disease or burden that a person has or possesses, but an experience that is ultimately temporary, though often rooted in past trauma or grief that hasn't been resolved. Depression involves emotions and energy, as well as thoughts and chemistry, since those are all part of an integrated holistic system. Uncovering the causes and bringing healing to those issues is more important, in my view, than identifying how severe the current symptoms are assessed as. This brings us to the sixth question. Were you ever unable to properly diagnose a patient? When inadequate or misleading information has been provided, I haven't been able to offer a clear diagnosis. though in my view the psychiatric philosophy or paradigm of diagnosis has inherent limitations and problematic repercussions. In other words, both clients and professionals can become too attached to the diagnostic label. Since my professional work is more about healing the person than about the diagnosis and medical model of treatment, I am often working with people in a non-medical context where I'm not diagnosing them with any psychiatric label. Often I see people who are already diagnosed by other professionals who offered little in terms of helping that person heal from what actually caused their symptoms. Those who are too focused on the diagnosis have often fostered negative or limiting belief systems that actually interfere with the client's self-concept and healing process. By focusing on the whole person and how they can become healthier and happier, rather than on what is supposedly wrong or disordered with them, I find I am better able to help and empower them. While having a diagnosis can be helpful in the sense of conceptualizing key issues present with a person and communicating about the person or case to other professionals or members of the public, there are also ways in which the very act of making a medical diagnosis can be counterproductive. Thus, the meaning and significance that we attach to a diagnosis is something I believe we would benefit from being more cautious and mindful about. This brings us to the seventh question. Do you believe over-medication is an issue in America? Yes, it is unquestionably a major problem that is contributing to negative mental health outcomes and actual worsening of mental illness. So, in America, as well as many other countries, the healthcare paradigm has become preoccupied with using pharmacology to manipulate chemistry as an effort to influence emotional and mental states and behaviors, rather than working from the reverse angle or reverse flow of causality, looking first at the consciousness, seeing what's actually happening in the mind and the energy system of a person that's in turn influencing their nervous system, their endocrine system, their organs and biology. So the consciousness is always working in a causal way, and if we ignore that and just go right away into trying to artificially manipulate chemistry, we will often cause more harm rather than benefit. And the eighth and final question here is, which are the disadvantages and advantages of antidepressants? The advantages are that it is something simple to do. So a person can take a pill every day, which requires minimal planning or effort, and which often costs the patient no money since their insurance often fully covers that form of treatment. For long-term outcomes, there are no advantages. The disadvantages are that the medications often have negative effects on different organs and systems of the body, harmful interactions with other medications and substances, and they can offer a temporary false sense of relief from emotional distress which is still in the person's subconscious mind and energy field waiting to resurface as soon as the drug wears off. Thus, a disadvantage is that it very often leads people away from truly addressing the issues that have caused their distress. Historically, people have used a variety of drugs to temporarily escape from emotional distress. As examples, Alcohol, heroin, cocaine, amphetamines, tranquilizers, and marijuana have all been used by many people because they provided temporary relief or escape. But over the long term, they lead to a lot of addiction and end up compounding people's psychological problems. Using prescription antidepressants includes the same type of risk, though the risk is less obvious because the drug dose is usually regular and controlled since it's a prescription, so that signs of tolerance and withdrawal don't appear as quickly as they often would with recreational drug users. So that summarizes how I would address these questions and concerns about mental health treatment. Clearly, my focus is on holistic wellness, on looking at all levels of a person's being and seeking to find what are the actual causal factors that can be addressed in order to promote health and harmony. For those that are looking for support and assistance in the area of mental health, you can watch some more of my YouTube videos on these subjects. And I also encourage you to explore my website, www.phinsights.com. That's PHINSIGHTS.com. You'll find information about the services I provide, as well as links and articles and other resources pertaining to holistic health and wellness. I'd like to wish everyone a wonderful day. Namaste.